7 Early Warning Signs of Colon Cancer You Should Never Ignore. Colon cancer is no longer a disease that only affects older adults. Research shows that cases in adults under 50 have been increasing over the past several decades. This change has surprised many doctors because people who once believed they were too young to worry are now being diagnosed more often than ever before. The encouraging news is that colon cancer is often highly treatable when it is found early. But if it is discovered after it has already spread, treatment becomes much more difficult. That is why recognizing the early warning signs matters so much. Research shows that in patients of all ages, many are seeing a clear pattern. More younger adults are arriving with symptoms they believed were caused by stress, hemorrhoids, food intolerance, or a sensitive stomach. In many cases, those symptoms had been present for weeks or even months before they were taken seriously. Throughout years of caring for patients with digestive diseases, physicians have learned an important lesson. Colon cancer rarely begins with one dramatic symptom. Instead, it often starts with small changes that seem harmless on their own. When these changes are recognized together, they can provide valuable clues that should not be ignored. In this video, I'll walk you through 7 early warning signs of colon cancer that every adult should know. Most of them are easy to mistake for common digestive problems, which is exactly why they are often overlooked. Be sure to stay until the end, because the final warning sign is one that many people never connect to their digestive health. Before we begin, it helps to understand what the colon actually does. The colon is the last part of your digestive system. It absorbs water, forms stool, and helps move waste out of your body. Colon cancer usually develops slowly over several years, which means the body may send small warning signals long before the disease becomes advanced. Looking for patterns instead of focusing on just one symptom can help you know when it is time to speak with your healthcare provider. Let's begin with the symptom that sends more people to the doctor than almost any other. The first warning sign is a lasting change in your bowel habits. This could mean having diarrhea more often than usual, becoming constipated without a clear reason, or going back and forth between the two. It may also mean your stools look different or your normal bathroom routine suddenly changes. Most people do not think much about this at first. They often blame a change in diet, stress at work, traveling, or a stomach bug. In many cases, they are right. These everyday problems can affect your digestion for a short time and then go away on their own. The concern begins when the change does not go away. Your colon has an important job. It absorbs water from the food you have digested and helps form stool before it leaves your body. If a growth develops inside the colon, it can interfere with this process. It may narrow the space where stool passes or irritate the lining of the bowel. As a result, your normal bathroom pattern can begin to change. Research suggests that a persistent change in bowel habits is one of the earliest symptoms reported by many people who are later diagnosed with colon cancer. This symptom does not mean you have cancer. Conditions such as irritable bowel syndrome, infections, or certain medicines can cause similar changes. The key difference is how long the symptoms last and whether there is a clear reason for them. A simple rule can help. If your bowel habits stay different for more than 3 to 4 weeks without a clear explanation, it deserves a medical evaluation. Speaking with your healthcare provider early can help identify the cause, whether it is something minor or something that needs prompt treatment. But changes in your bathroom routine are not the only warning sign. The next one is often dismissed even more quickly, and many people assume it is harmless when it should always be taken seriously. The second warning sign is seeing blood in your stool or on the toilet paper. This can be alarming, but many people quickly tell themselves it is probably just hemorrhoids. While hemorrhoids are a common cause of rectal bleeding, they are not the only one. Assuming you know the cause without being checked can delay finding a more serious problem. The color of the blood can offer an important clue. Bright red blood usually comes from the lower part of the digestive tract, such as the rectum or the lower colon. Dark red or almost black stools may suggest bleeding higher up in the digestive system. Although the color may help doctors understand where the bleeding is coming from, neither type should be ignored. Colon cancer can cause bleeding when a growth irritates the lining of the colon. Sometimes the bleeding is easy to see. Other times, it is so small that it cannot be seen with your eyes. Over weeks or months, even this slow blood loss can affect your health. Research shows that rectal bleeding is one of the symptoms most often reported before a diagnosis of colorectal cancer. At the same time, most people who notice blood do not have cancer. Conditions such as hemorrhoids, small tears in the skin around the anus, called anal fissures, or inflammation can also cause bleeding. That is why the goal is not to assume the worst. It is to find the real cause. The rule is simple. Never ignore unexplained rectal bleeding. Even if it happens only once, or even if you think you know why it happened, it is worth discussing with your healthcare provider. Finding the cause early can provide peace of mind or allow treatment to begin before a problem becomes more serious. But blood is not the only sign that something may be changing inside the colon. The next warning sign often feels like an everyday stomach problem, which is exactly why so many people overlook it. Another early warning sign is ongoing belly pain or cramping that does not seem to have a clear cause. Almost everyone has stomach pain from time to time, so it is easy to blame it on something you ate, stress, gas, or a condition like irritable bowel syndrome, also called IBS. In many cases, those are the correct explanations. But when the discomfort keeps coming back or slowly gets worse, it deserves closer attention. Your colon is like a long pathway that moves waste through your body. If a growth begins to develop inside that pathway, it can narrow the space where stool passes. At first, the blockage may only be partial, so waste can still move through. However, the bowel has to work harder to push everything along. This extra effort can lead to cramping, pressure, or aching that returns again and again instead of going away completely. The location of the pain can vary from one person to another. Some people notice discomfort in the lower part of the abdomen, while others feel pain across the middle of the stomach. The important point is not exactly where it hurts, but whether the pain is new, persistent, and different from your usual digestive discomfort. Research suggests that ongoing abdominal pain is one of the symptoms that can appear as colon cancer develops. On its own, this symptom does not mean you have cancer. Digestive infections, food intolerances, and many other common conditions can also cause stomach pain. That is why doctors look at the whole pattern of symptoms instead of relying on one sign alone. A helpful rule is this: if belly pain or cramping continues for several weeks, keeps returning, or is accompanied by other warning signs such as changes in bowel habits or rectal bleeding, it is time to speak with your healthcare provider. Early evaluation can help identify the cause before it becomes a bigger problem. But here is something many people never expect. The next warning sign is often seen as good news, even though it can sometimes point to a hidden health problem developing inside the body. The fourth warning sign is unexplained weight loss. Many people are happy when they notice the number on the scale going down, especially if they have not been trying very hard to lose weight. It can feel like a welcome surprise. But when weight drops without changes to your eating habits or activity level, it is important to understand why. Your body normally gets energy from the food you eat. Those nutrients help your muscles, organs, and immune system work properly. When colon cancer develops, the body can begin using energy in a different way. Cancer cells need nutrients to grow, and they can change how your body uses calories. At the same time, some people absorb fewer nutrients because the tumor affects how the digestive system works. This means you may lose weight even though you are eating the same amount of food. Research suggests that unexplained weight loss can be an early sign of several medical conditions, including some cancers. However, it is important to remember that many other health problems can also cause weight loss, such as thyroid disease, diabetes, digestive disorders, or certain medicines. This is why doctors look at your overall health, your medical history, and any other symptoms you may have before reaching a diagnosis. A simple rule can help. If you lose weight without trying and cannot explain the change through diet, exercise, or another clear reason, make an appointment with your healthcare provider. Finding the cause early gives you the best chance to treat whatever is behind it. Weight loss by itself does not tell the whole story. Sometimes the body sends another signal long before the number on the scale begins to change. The next warning sign is one that many people blame on a busy schedule or poor sleep, when it may actually be pointing to something that deserves a closer look. The fifth warning sign is constant fatigue that does not improve with rest. Everyone feels tired from time to time. A busy week, poor sleep, stress, or caring for family can all leave you feeling worn out. But when tiredness continues day after day without a clear reason, your body may be trying to tell you something important. One possible reason is slow blood loss from the colon. Some colon cancers bleed a very small amount over a long period of time. You may never see blood in your stool because the bleeding is too slight to notice. Yet over weeks or months, that small loss can reduce the amount of iron in your body. Iron helps your body make healthy red blood cells. These cells carry oxygen from your lungs to every part of your body. When your iron level becomes too low, you can develop iron deficiency anemia. Anemia simply means your blood cannot carry as much oxygen as it should. As a result, you may feel tired, weak, short of breath during normal activities, or find it harder to concentrate. Research suggests that unexplained iron deficiency anemia, especially in adults, should always be evaluated to find the cause. Colon cancer is only one possible reason. Stomach ulcers, poor iron absorption, certain medicines, and other medical conditions can also lead to anemia. The important step is not to guess, but to be properly assessed. A helpful rule is this: if you have ongoing fatigue that does not improve with rest, or if blood tests show iron deficiency anemia without an obvious explanation, speak with your healthcare provider. Identifying the cause early is the best way to protect your health. But here's where it gets even more interesting. The next warning sign is one that many people have never heard of. It is not painful for everyone, yet doctors consider it one of the more specific clues that something may be affecting the lower part of the colon or rectum. The sixth warning sign is a feeling that you still need to use the bathroom, even after you have just finished. You may sit on the toilet, have a bowel movement, stand up, and then feel as though there is still more to pass. This feeling has a medical name called tenesmus. In simple terms, it means your body keeps telling you that your bowel is not empty, even when very little or nothing is left. Many people ignore this feeling because they think they need more fiber, are constipated, or have a temporary stomach problem. While those can certainly be possible causes, this symptom should not be dismissed if it continues. The reason is surprisingly simple. When a growth develops in the lower part of the colon or the rectum, it can press against the wall of the bowel. The nerves in that area send signals to the brain, making it feel as though stool is still waiting to come out. Even after you have emptied your bowels, those signals may continue, creating the urge to go again. Research suggests that tenesmus is one of the more specific symptoms seen in cancers that develop near the rectum. It can also occur with other conditions, including inflammatory bowel disease, infections, or severe inflammation. This is why doctors do not rely on one symptom alone. They consider your full medical history, your physical examination, and any other warning signs you may have. A good rule to remember is this: if you repeatedly feel that your bowel never fully empties, or if this sensation lasts for more than a few weeks, make an appointment with your healthcare provider. It may turn out to be a treatable condition, but it deserves a proper evaluation. So far, we've covered symptoms that many people can notice. But the final warning sign is different. In fact, many people never see it at all. It often appears only on a blood test or through routine screening, which is why it can be one of the easiest signs to miss. The seventh warning sign may be the easiest to miss because it often causes no clear symptoms at all. Some people feel completely healthy and continue with their normal lives, unaware that a small problem has been developing inside the colon for years. One reason for this is hidden blood loss. Some colon cancers release tiny amounts of blood that cannot be seen in the stool. The loss is so small that it may continue for weeks or even months without being noticed. Over time, this slow bleeding can lower the body's iron stores and eventually lead to iron deficiency anemia. At first, you may not notice anything unusual. As your iron level drops, you might begin to feel more tired during everyday activities or find it harder to keep up with your normal routine. But many people never experience these changes until the disease has become more advanced. Others have no warning signs at all. Research has shown that colon cancer can grow quietly for a long time before causing obvious symptoms. This is why doctors place so much importance on screening. Tests such as stool-based screening and colonoscopy can sometimes find abnormal growths before they become cancer or detect cancer at an earlier stage, when treatment is often more effective. The right screening test and the right time to begin depend on your age, your personal health history, and your level of risk, so it is important to discuss these with your healthcare provider. The most important message is not to wait until you feel sick before thinking about your colon health. Paying attention to your body is important, but routine screening can find problems even when your body has not yet sent a clear signal. Now that we've covered all 7 warning signs, let's bring everything together and review the simple steps you can take to protect your health and know when it is time to seek medical advice. We've covered 7 early warning signs that may deserve closer attention. The most important thing to remember is that these symptoms are common, and in many cases they are caused by conditions other than colon cancer. A lasting change in bowel habits, blood in the stool, ongoing belly pain, unexplained weight loss, constant fatigue, the feeling that your bowel is not fully empty, or iron deficiency can all have different causes. What matters is not jumping to conclusions, but also not ignoring changes that continue or have no clear explanation. One symptom by itself does not mean you have colon cancer. Doctors look at the whole picture, including your symptoms, your medical history, your family history, and the results of any tests that may be needed. If something about your health feels different and does not improve, trust your instincts and speak with your healthcare provider. Getting answers early is always better than waiting and wondering. Another important step is to stay up to date with colon cancer screening. For adults at average risk, screening should begin according to the current recommendations in your country and the advice of your healthcare provider. If you have a strong family history of colon cancer, inflammatory bowel disease, or certain inherited conditions, your doctor may recommend starting screening earlier or having it more often. Now I'd like to hear from you. Which of these warning signs surprised you the most? Let us know in the comments below. Your experience may encourage someone else to pay attention to a symptom they have been overlooking. If you found this video helpful, please subscribe and share it with your family and friends. A simple conversation about these warning signs could encourage someone to seek medical care sooner, and that can make a meaningful difference. Finally, remember that this video is for education only. It is not a diagnosis or a substitute for personal medical advice. If you have persistent symptoms or concerns about your digestive health, please speak with a qualified healthcare professional. Small steps, taken early, can help protect your health for years to come.